Recovery is not optional, it's where the progress happens. Taking care of yourself is more than a fad, it's foundational to a long, vibrant life. When you train hard, recover poorly, or neglect your body's signals, you run the risk of injury, burnout, and chronic health decline. Proper recovery accelerates gains, preserves your joints and tissues, supports mental clarity, and guards against overtraining and injury. If you think training is the hard part, remember, the adaptation, repair, and growth happen after the stimulus, when your body is given the right conditions to heal. This talk will cover 1. Why self-care matters, 2. Risk factors that impair recovery, 3. Warning signs your body is overdue for rest, 4. Actionable recovery strategies, 5. Prevention and self-care plan, 6. Science and history, 7. Consequences of neglect, and 8. Concluding motivation and disclaimer. Even with a well-designed workout plan, many people unintentionally sabotage their recovery. Common culprits include poor nutrition or macro/micronutrient deficits, inadequate protein, poor quality carbs, insufficient vitamins and minerals, all slow tissue repair. Lack of antioxidants or anti-inflammatory nutrients means your body struggles to control oxidative stress. Insufficient sleep or poor sleep quality. Sleep is when much of hormonal regulation, tissue repair, and immune recovery occur. Fragmented sleep or short durations blunt recovery. Chronic stress or high sympathetic load. Constant stress raises cortisol, disrupts hormones, for example testosterone, and shifts the body into fight, flight rather than repair mode. Dehydration and electrolyte imbalance. Water is essential for nutrient transport, waste removal, joint lubrication, and cell function. If you're underhydrated, recovery slows. Overtraining, insufficient rest between sessions, too frequent or too intense training without deloads leads to cumulative fatigue, microdamage accumulation, and overuse injuries. Poor circulation, inadequate movement outside of training. If you sit many hours, your circulation is sluggish, which impairs nutrient delivery to muscles and slows waste removal. Lifestyle habits, smoking, excessive alcohol, poor metabolic health. These directly hamper tissue repair, oxygen delivery, and immune recovery. Underlying health issues, inflammation, hormonal imbalances, autoimmune inflammation, thyroid dysfunction, chronic illness, or metabolic dysregulation or reduced recovery capacity. When these factors coexist, you may train harder but recover poorer. The net effect is regression, risk, or stagnation. Diseases, conditions that can arise from poor recovery and self-neglect. If you chronically push hard without adequate recovery and self-care, the following are possible: overuse injuries, tendinitis, stress fractures, joint degeneration, hormonal disruption, low testosterone, dysregulated cortisol, thyroid suppression, immune suppression, more frequent illnesses, slower healing, persistent inflammation, chronic fatigue, burnout syndrome, metabolic dysfunction, insulin resistance, impaired glucose control, poor mental health, mood swings, depression, anxiety, cardiovascular stress, high resting heart rate, hypertension, muscle loss, catabolism, inability to maintain gains, degenerative joint disease, cartilage wear, arthritis. Essentially, the stress repair balance tips the wrong way and your body starts breaking down rather than building up. Symptoms, warning signs that your body needs recovery. Watch for red flags that your recovery is falling short: persistent soreness that doesn't resolve in 48 to 72 hours, unusual fatigue, not explained by daily life, decline in performance, weights, reps, stamina, elevated resting heart rate or heart rate variability changes, trouble sleeping, night wakings, unrefreshing sleep, mood changes, irritability, apathy, low motivation, frequent illness or slow to bounce back, stiff joints, pins and needles, muscle aches beyond normal, DOMS, appetite changes, hormonal symptoms, for example libido drop, plateaus or regressions despite consistent training. When multiple of these signs show up, your body is begging for more rest, better support, or an adjustment. Here are practical, evidence-backed methods to accelerate recovery. You can layer them, they are not mutually exclusive. 1. Nutrition and fueling adequate protein. Aim for 1.6 to 2.2 grams protein per kilogram of body weight, varies by training intensity. Carbohydrates. Replenish glycogen, particularly if doing repeated sessions or high-volume work. Healthy fats and anti-inflammatory foods, omega-3s, monounsaturated fats, colorful fruits/veggies for micronutrients. Antioxidants and phytonutrients, berries, leafy greens, turmeric, ginger help moderate oxidative stress. Post-workout window, within 30 to 120 minutes, a balanced snack or meal helps jumpstart repair. 2. Hydration and electrolytes. Drink sufficient water before, during, and after. Replenish sodium, potassium, magnesium, calcium if sweating heavily. Use beverages that support absorption, for example moderate electrolyte drinks, if necessary. 3. Sleep and sleep hygiene. Target 7 to 9 hours nightly, or more on heavier phases. Maintain consistent sleep schedule, same bedtime, wake time. Use a cool, dark, quiet environment, avoid screens 1 hour before bed. If needed, short naps, 20 to 30 minutes, can help but avoid messing with nighttime sleep. 4. Active recovery and movement. Low intensity cardio, walking, cycling, swimming, helps blood flow and nutrient delivery. Gentle mobility, stretching, yoga, foam rolling, soft tissue work. Contralateral or light movement for trained muscle groups, for example light days or deload sessions. 5. Contrast, temperature, modalities. Cold, ice baths, 10 to 15 minutes, can reduce inflammation in some cases, especially after very intense sessions. Heat therapy, sauna, hot tub, may help relax muscles and improve circulation. Contrast, alternating hot/cold, is sometimes used, though effects are moderate. Massage, percussion guns, compression garments, pneumatic boots, if resources, useful adjuncts but not magic. 6. Strategic rest, deloads. Built-in rest days or recovery days each week. Scheduled deload weeks every 4 to 12 weeks, lower volume or load, to allow systemic recovery. Be willing to skip or lighten a session if you feel signs of overreach. 7. Stress management and parasympathetic activation practices like breathing exercises, meditation, journaling, nature walks, cold exposure. Lower daily stressors to allow more repair mode rather than chronic sympathetic dominance. 8. Monitor and adjust, track recovery metrics, resting HR, HRV, sleep quality, mood. Use wearable data, if available, to gauge when to push or back off. Adjust training volume or intensity based on recovery feedback. 9. Medical, supplement support, if needed discuss with a physician or sports nutritionist if persistent issues. Supplementation, under supervision, vitamin D, magnesium, omega-3s, collagen, creatine, which also supports recovery, adaptogens, carefully, etc. Physical therapy or massage for problematic areas. These strategies, in combination, help you bounce back faster and more reliably. To maintain consistent recovery over months and years, build these habits into your life: daily balanced meals with protein, carbs, fats, fiber, micronutrients. Hydrate early and often. Short mobility, movement breaks, especially if sedentary. Sleep hygiene rituals, winding down before bed. Stress resets, breathing, short walks weekly. At least one full rest or active recovery day. Soft tissue work, foam roll, massage, stretching. Light cardio, movement only sessions. Monitor recovery markers, soreness, mood, energy. Monthly, quarterly scheduled deload or reset weeks. Recovery modality experiment, for example trial cold, sauna, compression lab checks, hormone panels, inflammation markers, vitamin levels adjust training blocks based on how well you're recovering. Recovery is not a one-off task, it's a consistent practice that compounds over time to higher performance, resilience, and health. Historical self-care traditions. Many ancient medical traditions, Ayurveda, traditional Chinese medicine, Greek medicine, emphasized rest, diet, sleep, and periodic fasting as part of wellness. Evolution of exercise science. Early strength and conditioning recognized the need for rest. Now we scientifically understand mechanisms like muscle protein synthesis, inflammation moderation, hormonal signaling, and neural recovery. Recovery research. Studies have documented that more than 50% of performance adaptation comes from rest and recovery, not just stimulus. Modern wearable tech, HRV. Recent decades have seen personalized recovery metrics, HRV, resting HR, strain scores, guide training decisions. Debunking myths. For example, no pain equals no gain is moderated by evidence that overly aggressive recovery, for example too much cold, too much stretching, can blunt adaptation. The science emphasizes a balance. So, recovery science is not new, but it has matured, giving us tools to train harder and smarter. If you repeatedly ignore recovery, consequences pile up: chronic overtraining syndrome, prolonged fatigue, performance collapse, hormonal disruption, increased injuries, stress fractures, tendon ruptures, joint issues, plateaus or regressions in strength, size, or fitness, immune suppression, more illness and slower healing, burnout, loss of motivation, mental exhaustion, metabolic dysfunction, hormonal imbalances, mood disorders in worst cases, forced extended breaks, surgeries, or long-term damage to tissues. Recovery isn't optional. Neglecting it undermines every ounce of effort you put into training. Faster recovery is not about tricks or shortcuts, it's about respecting your body, giving it the conditions to heal, and letting adaptation catch up. You train to break down, you recover to build up. When you sleep deeply, fuel intelligently, move smartly, and manage stress, every workout becomes more effective, sustainable, and safer. Don't wait for breakdowns, pain, or injury to force you to rest. Be proactive. Build recovery as part of your training identity. Let consistency, resilience, and self-care be your guiding pillars. This content is for educational purposes only and does not replace professional medical, nutritional, or training advice. If you have medical conditions, injuries, or concerns, consult a qualified healthcare provider or certified coach before applying new recovery strategies.